All right, for the sake of time, we're going to go ahead and get started. So welcome everybody to this session on mental health and COVID for Rare Disease Day/week. So Rare Disease Day is actually tomorrow, but we are finishing up our week of activities today. So we really appreciate having two real experts in the field come and share with us. Dr. Jen Bowden, Dr. Brianna Brooker, I'm sorry, Bree, from Helen DeVos Children's Hospital. And, you know, the question that we pose to them is, hey, mental health is hard. COVID has made mental health hard, and rare disease is hard when it comes to all this. So what are the things that we should be thinking about and considering just in the world that we live, in the world that will eventually, I guess, start to shift a little bit? So with that said, I will turn it over to both of them. We will hold questions until the end, but please feel free to put them in the chat, both in Zoom or Whova, as they come to mind, and we will loop back at the end. So without further ado, I will turn it over to you both.
Thank you, Caleb. I'm excited to be here today to talk about how to support pediatric mental wellness during COVID, and Dr. Brooker will also talk about how to support their education. I do want to give you a heads up that I have children who may be coming in from the snow, so there may be a little bit of noise in the background for you to ignore. So today we'll be talking about being familiar with the many stressors affecting children and adolescents during COVID. I would like you to really understand common reactions to stress, but then to know when to worry about more signs of mental health problems or pathology. I want you to be familiar with at-risk populations and then know how to support children and adolescents to increase the resiliency factors and to decrease their risk factors. So I really want to start with a kid that I would see in practice. So I want you to focus on Jenna. So she lives with her mother, her father, and her younger brother. She attends a local high school that's a public school. She's a great student. She has few friends and that are really close, and a boyfriend, and she runs track. In February of 2020, the schools shut down and her mother lost her job as she was in healthcare and they were making cuts, and her father was laid off. Her track season was canceled. In April, the family had spent through their savings and they had to sell their home and move to an apartment. And that meant that Jenna had to change schools and she was isolated from her friends and her boyfriend. Her grades started to fall because of her poor learning on virtual schooling and having to change schools, so the material was different. Her parents started arguing a whole lot more, and her brother started having tantrums regularly. And then her mood started to fall along with she would start isolating and just kind of hanging out in her room by herself all of the time. And then she started having thoughts about not wanting to live anymore and thoughts about ways to make that happen. So let's talk about the many, many stressors that are affecting the pediatric population right now. So if you could think of the stressors that you can, just off the top of your head, of all the stressors that children are facing in 2020 and 2021, some real major issues with food shortage, housing shortage, parents' lack of income, learning from home, disrupted education, disrupted sports, isolation, loss of mentoring and support from friends. And we definitely see this in the case example. Boredom, cabin fever, fear of illness, loss of loved ones, severe isolation from personal quarantine, disruptive mental health treatment that was previously available in school, and then also disrupted services. And this is definitely applicable for children with chronic illness, including OT, PT, speech, and sometimes ABA. So different therapies are disrupted too, and mental health care. especially during the early months when everything had to switch over to virtual. Some of these therapies just don't work virtually, and some kids with chronic illness will not participate virtually with these therapies. They're just not effective. The LGBTQ community also are at risk if they have unsupportive homes. Schools can be a way to escape that, and sometimes they are put in more stressful situations when they are maybe not out to their families, or they are and their families are unsupportive. The parents' own mental wellness definitely has an impact on the children's mental wellness and the mental wellness of the family. Parents having to teach their children from home while working, that adds extra stress. Parents that have to work and children having to babysit for other children, or just not having adults at home and just being there all day. And then worrying about their parents' own physical health or their loved ones' physical health or their own health. What's going to happen if I get COVID? And then the increased screen time. So we know that a lot of screen time is just not good for children's mental wellness. But during this time, there really hasn't been another option for kids who are stuck in these situations where their parents are gone all day, or they're isolated. They have to stay in the home. The weather's not conducive for them being outside, things like that. So this has sort of created a pressure cooker effect on families. So there's been increased stress in the society in 2020 for many reasons, and increased stress on each family member. And then there's been less support, less connection to our loved ones, less connection to other people that are just, maybe not a loved one, but their friends, their colleagues, their teachers, their somebody who smiles at you and tells you something positive about yourself, or helps you to distract yourself from the worries and stresses that you have. There is also a decline in mental health, and so this has led to increased rates of domestic violence and abuse and neglect of children directly. So what are common reactions to stress that you can expect in children and adolescents? So we expect grief when they lose things like their sports and their school and their friends, grief from actual loss of loved ones. You can see regression. So regression is when a child has gained a skill but then loses that skill. And so regression can even come in social skills too, but we often see it in things like toileting. So a child who previously was potty trained and then loses that ability. Somatic symptoms. So these are symptoms where your brain experiences an emotion and they come out in physical symptoms. And so this could be headaches, stomach aches, pain in your joints, pain in your muscles, back pain, things like that. And it can even create problems with like GI functioning and vomiting, things like that. We sometimes see mood symptoms, so grumpiness, irritability, low mood, tearfulness, and anxiety symptoms. You can also see nightmares or sleep disturbances. There can be a change in appetite, and there can be separation anxiety. But how do we know when to worry? So when do these become pathologic? And it's really if like their cognitive effects or emotional effects impact their work, play, and love. So for children, this would be like their school performance. Is it affecting their social activities, their ability to relate to their peers, and impacting the relationships with their family? So other warning signs of acute stress disorder or post-traumatic stress disorder would be reoccurring nightmares or like frequent nightmares, hypervigilance. So this is when people are on edge or like startle really easily, hyperactivity when they previously weren't hyperactive. Again, separation anxiety that causes problems with the family or functioning, repetitive play of the trauma. Mood changes. So going back to the repetitive play, this would be play that reenacts the trauma but doesn't change over time. Again, mood changes, avoiding memories of the trauma, and risk-taking behaviors. Big warning signs would include like not taking care of their like brushing teeth, hygiene, taking a shower, brushing their hair, things like that, hopelessness, and like inability to do schoolwork. Warning signs of anxiety, again, circling back to the somatic symptoms. So if you're seeing that they're like losing weight or not able to keep their food down or vomiting often, if they are having aggression, if there's regression that is persistent and not improving, increase in repetitive behaviors, substance abuse, clinginess, signs of panic, and worsening tics can all be signs of warning signs of anxiety. And then warning signs of depression would be irritability in children. So the younger the child, the less likely they are to like look depressed and look like an adult who has depression that might not have as much energy and show their sadness all the time. Kids often just show like lability in their mood. So they might be happy one second and then screaming and crying the next. So that's where you get the irritability, withdrawal, weight loss or gain, substance use, arguing and opposition, aggression, and hopelessness or suicidal ideation. So at-risk populations, this definitely includes kids with chronic illness. So any population that previously had a lot of stress for whatever reason are more vulnerable during the COVID crisis, again, from that pressure cooker phenomenon. So minorities who are facing toxic stress through prejudice and institutional racism. This previously to COVID has already been shown to affect prematurity and low birth weight in the population. And these populations are more likely to face more of these stressors as COVID comes through. The LGBTQ, because of those issues that I talked about earlier, and just the lack of connection, kids in foster care, kids who are in the lower socioeconomic status, and then, like I said, kids with chronic illness. So how do we support these children and adolescents who have who are vulnerable or who are struggling? And that is by building resilience factors and decreasing risk factors. So we want to minimize the risk factors as much as possible. So we want to look at family functioning and really try to optimize that. We want to really concentrate on parental well-being. When we think about children's mental health, it's so closely linked to their parents because their parents are running the household and setting the stage for each day. Building the structure, taking care of all of those things like meals and running where you need to run to get all the needs met. And so parental mental health is so important. Parental substance abuse, we definitely know that substance use is going up during COVID, and that also affects their mental health and their functioning, socioeconomic status. So there's something in psychiatry and psychology that we call the Maslow's hierarchy of needs. And basically, if you don't have food or you don't have shelter, you aren't able to do those higher functioning things like do your schoolwork and worry about extracurricular. And those things are also important to mental health. So really got to meet the major needs before you can worry about those other things. So physical health, COVID has definitely made it very hard to get exercise and to do those previously structured sports. So thinking about how to really support the kids and adolescents with doing exercise. Does this mean as a family you go for walks or you go for hikes while socially distancing? Do you get them involved in local sports where there's mask wearing? That is also a little bit tricky, but you can fit in family exercise in the evening indoors too. Having a skill at something is definitely a resiliency factor. So thinking about how to help your child or the adolescent develop that skill and supporting all of those extracurricular activities, band, music, singing. Social functioning is also a resiliency factor. So we really need to think about connection and social connection. So how do we support that? Do we have a pod where the kids are seeing a few kids or friends and reduce the exposure to COVID, or do we really help them through social so media ways like FaceTime or other virtual meetups, and then thinking about how to foster those and really push those more. It's helpful to address the child's fear, to recognize it, validate it, but also to provide some hope that you're going to be with them together and that you're going to get through this together, and think about things that you can do in the future. It's really important, especially for younger children, but also for adolescents, to structure their day and have some expectations about what time they should wake up, what time they should eat, what time they should be doing their schoolwork, when they get home from school, what are you doing as a family? And then to use positive discipline. So really focus on the things that they're doing well and praise those specific things. I really like that you're doing your work responsibly. I like that you're sitting still on the chair on your bottom. And then to really know how to ignore negative behaviors, and also setting up expectations of what you want the child to do during that day, using rewards and privileges, and then time-ins and sometimes timeouts, but really trying to avoid physical punishment. More physical affection can be really helpful. I have an example of this. I have a teenage daughter who, during the first part of COVID, would come over and jump her whole body on me during the shutdown, during the isolation. And I think it was her way of saying, I need more attention and physical affection. I'm feeling anxious. So really to focus on that and think about that throughout the day. And then purpose. So it's important to connect to the larger community, and to think about how you can make an impact and your family can make an impact in small ways. So also connecting the family to any support. So is this providing meals? Is this really creating support groups virtually to help connection? Is this a religious connection? Any sort of support systems, it's really important to surround the family with during this time. And then brief family psychotherapy can be helpful, individual therapy, parenting therapy, and treating psychiatric illness by your primary care or a psychiatrist when issues are identified and they're not responding to therapy, or it's moderate to severe. It's important to screen for mental health problems. The frequency of mental health problems right now is very high, and some studies I've seen it as high as even 50% in kids who are 17 and 18. So definitely we are seeing kids come in large numbers, a huge need. So it's important to do screening now. These are some free and evidence-based screeners. The GAD-7 screens for anxiety. The PHQ is an evidence-based screener for screening for depression. And then the Columbia is a great suicide screener. It also has a risk assessment tool to be able to place children and adolescents in low, moderate, and severe. And this is evidence-based really down to 5, but we recommend that all children 12 and up be screened. That's when we see a really large uptick in suicidal ideation. HealthyChildren.org is a wonderful resource by the American Academy of Pediatrics, and they have some just a plethora of literature on how to support children during this time, ADHD and learning during COVID-19 and caring for adolescents and children with special needs, children in foster care, all those vulnerable populations. So Jenna told her mom about her feelings about not wanting to live anymore, and her mother brought her to community mental health for an urgent assessment. They didn't find that she was at risk of imminent danger, and so they recommended that she start with therapy and to see her primary care doctor, who also started her on some medication for her depression. Her parents also connected to therapy, and there was reduced conflict in the home and the family setting. They really made an effort for that because they recognized the impact on their children. Her parents set up more structure and support for her virtual schooling to help her with her academics. And then she got involved in one of the sports that was opening up, which, or one of the trainings, which is speed and agility in her school. And she made some friends through that. And then her parents encouraged her to make more efforts to connect virtually to her old friends and her boyfriend from the previous school. So in summary, there are many stressors affecting children and adolescents during COVID, which does directly affect their mental health. And the more stressors, the more impact on their mental health. There are common reactions to stress. These include things like grief, regression, somatic symptoms, change in mood, and anxiety. Warning signs include mental health problems and cognitive problems that interfere with relationships, school, or extracurricular activities. At-risk populations include any group that had previous stress, and this definitely includes anyone with a chronic illness. And then increasing resiliency factors and decreasing risk factors really helps children and adolescents during this time with their mental health.
Thanks for that, Jen. I'll go ahead and set up my slides here, transition to my portion of the talk.
Great. And just a reminder that Dr. Brooker is going to talk to you about how to support kids with their learning during this stressful time.
Yeah, thanks so much. You know, in planning for this talk, I think there are so many challenges in day-to-day life that COVID has introduced. And of course, intrinsically related to our mental health and well-being for families and children especially is the concept of cognitive and academic well-being. And we know, just similar to what Jen was talking about, children with rare diseases have increased risk for mental health concerns, but also for academic and cognitive struggles during this time. So we wanted to spend a little bit of time drilling down into this topic as relates to kids with rare diseases. So to give you a bit of a roadmap of the information that I'll be covering in this portion of the talk, I'll begin with a bit of an introduction into my work as a neuropsychologist, since this is the framework that I'm using to approach this topic. I'll talk a little bit about some of the concerns or risks associated with thinking and learning as relates to children with rare diseases, and then bridge that into talking about how COVID has particularly affected this population when it comes to schooling and education. I want to finish with discussing some strategies about how cognitive and academic well-being can be supported during this time. And then Jen and I will open it up to some questions if there are any that come up in the chat. So to briefly overview, as Caleb mentioned in the introduction, I work as a pediatric neuropsychologist at Helen DeVos. Part of that job is working with children with rare diseases to help understand the puzzle pieces of how their medical condition affects their brain development, and downstream from that, how those factors affect academics and learning, how they affect behavior and emotional functioning, and overall how those things together affect the child's well-being. So as a neuropsychologist, I'm a psychologist who has special training in the relationship between brain and behavior. And we use tests and other techniques to help evaluate how a child is functioning, both in terms of their brain functioning, so how we can assess that through cognitive or academic functioning, their thinking skills, as well as behavioral and emotional development. And then we put this information together to help make a treatment plan to support the child ongoing. So as relates to rare diseases, there are a number of questions that we're kind of often doing our work around. So often families or providers are wondering how a child's medical or neurological condition may be affecting a child's thinking and learning, how mood and behavior concerns may also relate to the medical condition or brain development. Some rare diseases carry with them an increased risk for brain injury, such as through stroke or periods of low oxygen flow to the brain. And so sometimes we're thinking about how those sorts of events may have affected a child's brain development or functioning, or how the child has been able to compensate after those kinds of events. And often a question that we face for both families and providers is what makes this child tick? Why are they doing the things that they're doing? Or what are these behaviors about that we're seeing, and how can we support them? And when it comes to academics and learning, we're often thinking about how can we help to support this child in doing their best learning and best functioning from a school standpoint. So there are two main ways that we provide this service to families. The first is that we provide evaluations. Typically, we're seeing kids as outpatients. They come into our office and complete an extensive a battery of tests. Often that takes up to a full school day sort of length. We also provide briefer consultation to medical teams that work specifically with rare disease populations. So for example, I work in a clinic at Helen DeVos for neurofibromatosis, which is one specific rare disease that can have some effects on thinking and learning. So when we're thinking about thinking and learning differences in children with rare diseases, of course, we're talking about a very diverse group of kids with very diverse medical and developmental differences. So there's not going to be a one-size-fits-all way to describe the specific challenges that come up in this population. But for many kids with rare diseases, the importance is that there are many complex factors to be considering and to have on the family, the provider, and the school's radar as they're considering what would be helpful while we're thinking about learning in the era of COVID-19. So when it comes to the ways that a rare disease can affect a child in terms of their thinking and learning, many children with rare diseases have differences in the way that their brain and body have developed. And so this can result in differences in overall intellectual skills. Some children with rare diseases have intellectual disability, meaning that they require a lot of support and repetition to learn new information, to develop academic skills, and develop self-care and daily independence skills. Many children with rare diseases may have normal intellectual functioning, but yet a specific array of needs when it comes to their learning. So problems with attention, such as ADHD, are common among kids with rare diseases. These kids may present with specific problems with memory or even executive functioning skills, which are planning, organization, problem solving, those sort of self-management skills that are really important, particularly as kids get older and are expected to manage much more academically on their own. We also know that kids with rare diseases sometimes have differences in sensory functioning or their motor skills that would also impact the way that they can participate in school generally, but also in the era of COVID-19. Kids with rare diseases also obviously have a lot of different medical needs that their other peers do not share. So they may miss school due to appointments or hospitalizations. There may be immune concerns that prevent them from going to school during COVID-19 or even during other times when germs are a concern. They may have medications that cause some effects on their thinking and learning skills. For example, children with epilepsy may sometimes have to take medications that improve their cognitive functioning because there are no seizures, but at the same time, those medications may have some cognitive side effects as well that they have to contend with. And finally, children with rare diseases may have some medical symptoms that can interfere with thinking and learning. Kids with chronic pain or chronic sleep disturbance may have reduced focus or learning during the day because of those issues. And then finally, as Jen outlined in her talk, there can be emotional and behavioral differences among kids with rare diseases. Aside from the COVID-19 pandemic, these kids just have a lot to cope and adjust with when it comes to their day-to-day life and medical symptoms. There can be neurologic differences that drive differences in how children regulate their emotions and behavior. Many children with rare diseases may struggle with change in routine, being flexible when the rules are thrown out, such as in the COVID-19 pandemic. And of course, this overlaps somewhat with autism spectrum disorders, which we do see at an increased rate among some children with rare diseases. And then finally, as a positive, many kids with rare diseases have strong and resilient families who are used to supporting and used to advocating for their child. And so that can be a real asset when we're thinking about changes in the entire script of how school planning goes, as we've seen in the past year or so. So I want to talk about some specific challenges that have arisen with learning in the era of COVID-19. And many of these you can kind of imagine based on the information that Dr. Bowden provided and from all of our experience over the past year. Many children missed some school, and this is not limited to kids with rare diseases. For a lot of schools just completely shut down for a few weeks to months while things were being sorted out and schools were scrambling to set up a plan for distance learning. So those opportunities for learning were just not there for many kids, but there is some evidence to show that children with rare diseases and special needs may be at increased risk for difficulties following disruptions in schooling. And so it may preferentially be an issue for kids with rare diseases. There are obvious differences in the way that schooling has been delivered, and for some kids is currently being delivered. So in terms of format, online schooling has happened for many children, but that varies widely from school district to district and child to child. So in some cases, that may be a very hands-on setup that looks very similar to how school typically has been. And in other cases, the virtual schooling may consist more of a plug and play sort of model where the child reads some text, responds to questions, and does that sort of self-directed learning throughout the day. So you can see that those differences in structure may create different problems based on the degree to which a child can read and comprehend, self-manage themselves, the rate at which they can progress on their own. So those have certainly been concerns and challenges over the past year as well. There have been some differences in school support. So particularly at the beginning of the COVID-19 pandemic, many children's special education services, including physical, occupational, and speech therapy that they were receiving through the school, were put on temporary hiatus as schools were trying to figure out what service delivery would look like during COVID-19. And even now, as some schools here in Michigan have progressed to being back in person for portions or much of the school year, there still are some services that if cannot easily be provided safely in person. And when schools are virtual, it's not always clear how some of those services can be provided as well. There are obvious differences in the school environment, which for some kids is the home environment now. And so that creates some challenges around structure and around parents being the new teachers for the child that we have to think about when we're supporting children. And then there's, of course, increased stress with this challenging transition to a new way of life. This has been really difficult for many families to navigate, but probably more so for children and families who are affected by rare disease that also have changes in their medical services that they have to contend with. And as I mentioned, changes in routine in general can be a real challenge for some children who really struggle with flexibility and mixing up the routine. So that can be a real barrier now that learning looks a little bit different in COVID-19. So all of that said, how can we help kids to adapt to the new normal for now? And how can we help kids succeed cognitively and academically while things look a little bit disrupted due to COVID-19? So one group of strategies that I'll talk about is around optimizing learning skills. So when children are in particular engaging in distance learning, there are a number of considerations that we can think about that would help support a school-like structure and help support academic success in the home setting. First, I think it's really important to have realistic expectations of what distance learning will look like given your family's structure and your child's individual needs. You know, some children and teens are really able to successfully self-manage schooling, and there's very little parent involvement needed in order to keep things moving from an academic standpoint. But some other children really require a high degree of support in order to be successful. All families have had a lot of changes to contend with during this time, so it's important to consider what your child's needs are and how those align with what your family can provide, and give yourself and your family some grace and understanding that what works for some people might not be a fit for your family or your child. I would recommend setting up a work area that supports focus, and this may vary from home to home in terms of what this might look like. If there is a separate place that's not frequently used for family activities, not frequently used for recreation, that you could set up that really is just for focusing on schoolwork, I think that would be optimal. But for not every family is that an option. And so having a routine or a way to kind of corral school activities to a set place like the kitchen table, and maybe having a tote or a bin where all of the school supplies go into. You take them out in the morning to signal the start of the school day and then pack them back up in the evening. Those sorts of routine elements can be really helpful in creating an expectation that work is to be done when it's during school hours. It's really important, to the extent possible, to reduce distractions. For younger kids, those distractions that we're thinking about might be external things, like making sure the TV is off, making sure that there's a quiet space to work, perhaps using noise canceling headphones to promote focus. For older kids, often the distractions that we're contending with are other technology, our social media that might be available on the same computer that they're using for schoolwork. And so there are some apps and computer programs that you could consider that can block access to social media and other distractions during the school day. These can be available as browser plugins that you can just add into Chrome or to Safari, or as computer programs that you could do to shut things down more broadly on the computer. It also might be helpful to consider having a spot where, kind of a home base where a child's cell phone might live during the school day while they're doing work, in order to promote focus. And of course, having structure and routine is helpful for both children and adults alike. So having predictability, having a clear schedule that the child is expected to adhere to is really helpful. For some kids, a traditional written out schedule can work really well. For other kids, using something like a visual schedule, which you see here on the right, can be a really helpful way to support moving through the school day, particularly if the child doesn't do well with reading, or those visual cues are much more helpful. It can also be helpful to use a timer to signal the start and end of discrete periods of work during the day, and also the start and end of breaks. What you can see here on the right is something called a time timer, which is a visual timer that helps children who do better with visual cues, or who maybe can't read time yet, to keep track of how much time is left in a work period or in a break. So that gives the child a bit of a visual cue, a visual heads up when it's time to transition soon to a new task. For more independent learners, it's appropriate to allow them some space to be managing things on their own, and to be keep moving through the school day with a little bit less one-on-one support. However, at the same time, it's also important to be considering that those kids may need some check-ins and some monitoring. So creating a shared checklist that maybe you can use through your phones, or create a Google Doc that helps you keep track of what they're crossing off during the day in terms of their academic tasks, can be helpful. And of course, having a proactive line of communication between home and school is really important, so that you can proactively identify any concerns, hear if the teacher has any concerns, and address them before they become an issue. It's pretty common that I meet families where much of the work that they've been doing, the kid has been doing, has not been getting turned in, because there's just higher level demands for organizing and staying on top of a number of assignments. And so it would be much better to learn about that when a few assignments have been missed, rather than an entire semester's worth of work, and put strategies in place to keep the child organized. I want families and providers to be aware of how special education supports are available right now. Special education can be kind of a maze to navigate, even in the best of times, and things have changed a little bit during COVID-19. But it's important to note that special education continues to be mandated during COVID-19. It is required that school districts identify and support children with disabilities, even if they're not currently enrolled in or attending public schools. Families can request evaluations for a child's eligibility for supports by just submitting a written request to the school's principal, special education director. And often there needs to be a kind of collaborative back and forth at this time to understand what the child's needs are, especially if the child is not physically in school, because the family is probably the best expert on how things are going with the child's academic functioning at this time and what the barriers may be. And again, that proactive communication is really important when it comes to monitoring supports and needs in an ongoing way. I just want to echo what Jen talked about when it comes to self-care. You know, our cognitive functioning is really teeters, and it rests on a foundation that's around our, basic medical care, our sleep, adequate nutrition, our management of stress and mood and social needs. And if any of those things are disrupted, we can see some downstream effects on a child's thinking and learning. So it's really important to optimize a child's sleep, even though there might not be a school reason to get up in the morning. Important to keep social functioning plugged in and to help manage any mental health concerns as they arise. And this applies to caregivers as well. This quote says, "An empty tank will get you exactly nowhere. Take time to refuel." You really need to be able to take care of yourself in order to support these really high level skills we're talking about for children as well. I want to just point you to a couple of additional resources to be aware of. For many children with rare diseases, there may be a genetic condition to think about, and this resource here called GEMS is an excellent resource that you may be aware of, which includes some information about specific rare diseases as relate to thinking and learning skills. So some of the information on this website can be really helpful to share with schools in order to make sure that the school understands how, again, those puzzle pieces of a child's medical condition may relate to thinking, learning, behavior. Many children with rare diseases have difficulties with focus. We know that some kids also have autism spectrum disorders. So these two organizations on the right, CHAD and the Autism Alliance of Michigan here in Michigan, are fantastic resources regarding supporting children with ADHD and autism, particularly in the era of COVID-19, but they're just generally fantastic resources to have in your back pocket as well. And then this last resource, Michigan Alliance for Families, is a really excellent resource guide here in Michigan around navigating special education supports and advocating for children in terms of school planning. So I just wanted to make you aware of those resources in your work with children or in your own family's work as well. So I'll wrap it up, and now I believe we have some time for questions if there are any questions from the audience. Thank you for your time.
Thank you, Jen and Bree, so much. We really appreciate you taking your time, particularly on a Saturday, to share this. There's just so much information. This is a great time for folks that have questions or comments, so go ahead and put it in the chat on either Zoom or Whova, and we'll go through those together. I thought maybe while people gather their thoughts or type, I'd maybe start with a question about baby steps. So you both have presented so much information, and there's so much out there, which is terrific. But what would you say to somebody that is just feels buried, and their question is, what's the first baby step I should take?
Yeah. So I think from a mental health perspective, just taking a moment to think about where they're at individually and how each one of them are doing. So doing an assessment and then deciding from there, what can I do to help with that mental health? So if everybody's doing okay, but they need to put in some more structure, then that would be where that would make sense. But if the family's really, everyone's struggling, then probably connecting to mental health resources would be the next best step. So I would say first doing some assessment and some thoughtful time of where each member of the family is doing, and then just taking one of the things that we said with the hierarchy of, do we need food? Do we need to really focus on shelter? And then how is the health of my child doing? Are they in pain? Like Dr. Brooker was showing that beautiful triangle. And then moving up that ladder of what is the next step from there.
Yeah, I absolutely echo that. I think if there is one one area of just basic, basic health and wellness that you can focus, there's no wrong answer. If it means making your children get to bed a little bit earlier or have a little bit more of a routine bedtime, if it means making sure that your kids and you are getting a little bit more exercise, I think all of these things add up over time to gains in your wellness and your bandwidth for addressing some of the bigger issues. And I absolutely echo reaching out for help can be a really important baby step. You don't have to have all of the answers. That's why people like Jen and I do what we do every day. We don't have the answers either always, but we are an ally for you, and we're here to help kind of tease apart of the multitude of things you could be working on, what feels like the most important thing to target right now.
I wonder if you would comment on the idea of siblings and how they fit into all this. A lot of rare disease patients, well, pretty much I think every rare disease patient has a family, whether biological or not, and there are other people that maybe don't have that rare disease, but maybe thinking about other kids that are in the family or in the house. What advice would you give folks for those people?
Yeah. So I think it's important to think about connection in general, even without COVID, kids who have siblings with special needs or other health conditions, where it takes the parents' attention and resources. First, it can be helpful for them to have their own place to go and talk. Sometimes that's therapy, sometimes that's support groups of other sibling groups that have someone in their family with other health needs or special needs. And then making sure to make time and think of efforts to help that child to build their own self-identity. So what are they good at? How can you help them to get involved in their extracurricular things or their music, their hobbies, and get them connected there too. And also to talk about their role in the family and helping to make sure that they don't become parentified themselves, and helping them to maintain their own, personal childhood identity.
Yeah, I think that's fantastic. I don't have a lot to add to that other than to say, for many kids with special needs, if the sibling doesn't have a high level of need in the academic setting, I think it's really challenging. Sometimes those kids can fly under the radar if something is going on academically because those needs are dwarfed in comparison to the child with the much greater needs. And so again, just that line of proactive communication for every child. Shoot an email to the child's teacher and just say, hey, we're not seeing that anything is going on, but I wanted to confirm that, the child's doing well. Please let me know if there are any concerns, can really go a long way in making sure that there aren't any needs that are being missed just because that's not the child with, the greatest level of need in the family.
So I want to try to finish on a high note and kind of think positively towards the future. As you look at the field that you work in and the content that you've just shared, what are you excited about for the future? Like what is getting better? That is something we can take away as kind of a promise of a better tomorrow, if you will.
Yeah. So one thing that's a little bit of a tweak is that there really haven't been enough mental health resources out there for a very long time. And COVID has created a lot more need for mental health services. So I think it will push the services to grow. Also, I've seen a lot of growth in schools screening for mental health concerns. So I love the base that creates and says, this is important. We need to talk about this and we care about this. This is not just your academics. So it creates another way to pick up kids who are struggling. So I love that. I also am really looking forward to the rebound in health that is going to be created when kids return to school, when they return to their sports, when they get reunited with their friends. I think it's going to help them to appreciate that connection more.
I would say in terms of school and academic functioning, one thing that I've really been impressed by is I've seen so many parents blossom into advocates for their children in the academic sphere that maybe didn't need to be thrust into that role or had less of a hands-on view, just because now everything is hands-on when kids are learning at home and parents are the teachers. So I've seen a lot of families really grow in their understanding of how a child's medical condition may be affecting what's going on at school. And that really leads to fantastic advocacy and in many cases, really strong partnerships with the school as kids are getting back to learning. So that's been one really, really fantastic thing that I've seen come out of this pretty challenging time.
Awesome. Well, I can say on behalf of myself, but probably the audience as well, I think I feel better about the future after hearing from both of you, because day in and day out, it can feel very overwhelming and hopeless at times. But just know that you're not alone, and other people have been through it, and there are resources out there. I think is real encouraging. Well, thank you both for your time, for the work that you're doing, for the heart that you put into it, and for sharing with everybody. As a reminder that anybody joined late, this session was recorded, so be able to view all of it later. And then just a couple of quick housekeeping things. Please fill out the survey for this conference so that we can try to be prepared for a better future of planning and doing this kinds of events. You can continue to connect on the Whova app as well. And we have a closing video posted that you can go ahead and watch at any time. And then our exhibitors should be at their booths, their virtual booths, if you will. And I think a couple of those are actually resources that were mentioned here in this talk. So thank you again, everybody, for your time, Dr. Bowden, Dr. Brooker, and have a great rest of your Saturday, everybody.